Hi, Dr. Selby. I am Allison Valandria in your Vet 105 online course. These are the makeup procedures that I have for the Restraint video. I'll list them along the way. As I wrote in your email, I recently had a back injury. So for tasks such as Restraint for occlusion of the jugular and saphenous veins, I will be having an assistant, my boyfriend, doing so, but I will explicitly describe how I would do it, and I will point to the certain parts of the dog and cat's bodies to show you that I do understand the technique behind the procedure. Thank you. Hi again. As previously mentioned, my back will not allow me to do the restraining, but to show you that I understand the technique, this is Aaron and this is Monty. He's got her sitting upright for me. She's a very good dog. He's gonna sit behind her, hold at her chest so that she can't walk away from him. I'm gonna come straight at her with the collar. I like to hold it at the end so that she can't get to it. You can use gauze to secure them. I have a collar on it because personally I know my dog and many other difficult patients will shake it off instantly with the gauze, so having a collar is always handy. Over the nose, watch the eyes. Gently scoot it past their head. Twist it over. Mind their ears. To measure the best fit for an e-collar, you always want to make sure that the collar itself goes past their muzzle. That will ensure that if they were to bend down, they're not going to get to their incision and or catheter site. And now you have a collared, very sad, cone of shame dog. This is the treatment for the jugular puncture. Aaron has Monty's sternum on the kitchen/procedure table. So here, I'm going to move her collar up. I have him holding her muzzle up so she doesn't bite me. He's got his body weight on her back so she gets nowhere. His left forearm is on her feet so that they don't go anywhere. Normally with cats, you can also hang them over the edge. To occlude for it, technicians go down here, find the vein. And then your technician can stick. This is treatment for a saphenous vein puncture. I'm instructing Aaron to take Monty by both of her front and back right legs. He's going to put her on her side and put her to the ground. Gonna lean up a little bit, keeping his left arm on her neck for pressure, and he's gonna take his right hand, take her right leg, push it up towards her body and hold it there. But then he's also gonna take this arm and push down on the leg to help me occlude the vein. You need to sit up more. Occlusion for a saphenous vein puncture. Take your patient, take legs facing you or closest to you. Down to the ground. Take your left arm, or whichever arm is better. This is going to be holding the head down. take the patient's right leg, push it towards them. Your technician will pull the bottom leg out. You're going to take your hand, karate chop the leg down, and that will occlude the vein. Can you move the camera so that they can see it's popping up? And what you should see is the vein popping up right here. So Erin has Monty laterally recumbent on her side, obviously on her side. He's has her left leg pulled up for me. I'm going to pull forward and he's going to push down and occlude the vein for me, which is right here. So you can see circular motions with your cleaning agent, whether it's alcohol or Chlorhex, whatever your practice uses. Take your needle, bevel side up, and get your blood. For this part of the procedures, I'm going to be obtaining a TPR, temperature pulse respirations, mucous membrane report, and CRT, which is the capillary refill time. For the TPR, first you would do a temperature. Unfortunately, I do not have a rectal thermometer. However your patient would accept it in the rectum. If it were to be a two-person job for a temperature, your assistant would hold the patient like so, behind the ribs, under the neck, so that your assistant can lift the tail. And if you had a thermometer, put one in there. To get your heart rate, best way to do it would be right back here, on the left side where their heart is, behind where their elbow would be. Count for 15 seconds. Her left side, I'm sorry. I would count for 15 seconds, multiply that by 4. In a dog Monty size, big chest, her regular heart rate would be probably about 90 to 102. Her respirations, you can take your stethoscope, you can listen on their lungs, again for 15 seconds, or on your short hair dogs, you can watch the chest rise and fall. Every rise and fall counts as 1, count that for 15 seconds as well. That number gets multiplied by 4. Monty, on a calm day, she would probably be closer to 3640. Mucous membrane, that you can look at her gums. Want to make sure that they're nice, that they're not too tacky, nice and moist, meaning she's hydrated. Hydration can also be tested by pulling up on the scruff. Anything less than 1 to 2 seconds is considered good hydration. Capillary refill time, you would lift up the lip, push like you would on your fingertip, push till you see it's white, see how long it takes. 1 to 1.5 seconds is good. 2 is acceptable. Anything more than that, you want to tell your doctor. This is to test blood flow. It can also be related to hydration, but it's mostly for how fast the blood is going back into the organs. If you cannot get to your dog's mouth, some dogs will allow you to use their ears. You will get the same reaction. You could also use the folds of the vulva or the prepuce on your male dogs. And sometimes, if you're really lucky, you can use the pads, but all other ones are preferred to do first. Determining the sex of a dog, even spayed, whether spayed or neutered, intact or not, you would obviously look. Notice that she has a vulva, lack of testicles, even if males, even when they are neutered, will still have the testicle sacs. Obviously this is a vulva, and that's how you would tell the difference. Administering an ophthalmic solution can be done several ways on your flat and laterally recumbent patients, especially your patients who have been sedated, recovering from surgery. Most of those you can do with them laying down. However, with your dogs who, may be getting into things, poke themselves with a stick, which this one's very used to, you sometimes have to apply an ophthalmic solution. It can be liquid, sometimes it comes in a cream, kind of the consistency, a little bit less dense as toothpaste. I do not have any. She's obviously not prescribed any right now, and I do not want to give her anything that wasn't meant for her. So this is sterile water in a syringe. It would be the same procedure. So in a hospital setting, Aaron being my assistant, if she'll stay like that, that's great. But what I'm going to have him do is kneel down behind her and basically sit behind her as a barrier so that she doesn't go anywhere on me. And we call it a big, big hug. It's a lie to them. They hate us for it, but it's okay. So with Aaron hugging Monty, you want to make sure that you are opening the eye and dropping the solution in. Same with when you have your cream ones. Most of them you'll see will be prescribed 1/4 inch to 1/8 of an inch strip on each eye, so then you can take it and you would drag along. For your patients who are actually not very good with it, because not all dogs are, one way to do it is to get either your cream or your liquid right into the corner of the eye. You can let it collect and then just kind of squidge it in the eye, and it will naturally go in there for them. And much, much loves afterwards. Some medications require an intradermal injection. If I'm not mistaken, I think Buprenex is one of them. It can be oral, but it's one of the ones that's what you would do for it. So there's differences. There's subcutaneous, intradermal, and intramuscular. I'll be showing you them. I have nothing in my syringe. The point of this is just to show the understanding of each one. Can you guys scoot a little bit closer? Okay. So, center. Okay. And you can see here. There you go. And I'm sorry that my dog matches my assistant. We didn't mean to. So remember, when you do subcutaneous, you create your tent. Oops. When you're sub-Q, you create your tent. Go in between sub-Q. This is going into the muscle. And then you would always pull back on your plunger. Make sure you're not getting any blood. And do that. Change your needle. Oh, this is perfect. If you were to have an intramuscular, I'm actually not going to completely stick the dog with this. It would be into the muscle. The buttocks is nice and beefy, and it's more accepting than anywhere in the front would be. You would take it, go straight in, do it quick,
Do a quick pull back, make sure you don't have any blood coming out. Push your medication in, and there's your intramuscular. Your intradermal is into the skin, and this is going to create a polyp, much like the subcutaneous would be. However, you would not deliver subcutaneous fluids, or you wouldn't deliver fluids intradermally. So this, you would still you would still create your tent, but you're not going beyond the skin. You would go straight in. Again, pull back, no blood. Inject your medicine. Pull out. Rub for good luck. And Monty's done. Yay! Hi again, Dr. Salmi. This is my my remaining treatments for my restraint videos. As I mentioned in the email, I currently have a bad back, and I no longer have the permission or access to the cat I used in my original video. However, I will try to be overly explanatory of my understanding of the techniques for this. This is my makeshift cat. Let's call it Mittens. To restrain this cat and occlude for a femoral vein puncture, the femoral vein being in the back, I would take my kitty, nice and neat. I would take the his right leg, put him on both sides, put him on his side, take his back leg, push it towards him. My right arm would normally stay on his neck, but since he's not going anywhere, I'm showing you that my technician would be pulling this leg forward. While holding this leg down, I would be pushing down and occluding the vein, basically holding off for my technician. And it would be something like this. And if I had a particularly angry cat, I could be scruffing the kitty, shaking the head, telling her that it would be okay. Occluding for a saphenous vein or a cephalic vein puncture with Mittens sitting sternally. If she was being good, I would be giving her a hug on the treatment table, pulling forward for her, getting behind the elbow, twisting, making sure that the cephalic vein here is occluding and popping up. I like to hold my cats here. If need be, your cat could be on a counter and forward, so you could hold down here and still have control of the head. And again, your technician would be pulling the paw down while you're holding off and inserting the needle, whether it be for catheter or injections. Restraining Mittens in a lateral stretch. Not that Mittens needs much restraint. Once you scruff your kitty, take them, lay them on their side. You would take them all the way back, holding their legs, and having them as far back as you could. Normally this would be for moving or general restraint for TPRs, nail clippings, mat clippings, etc. Upright, this is what it would be, but she would be on her side. Performing confirmation of gender, including how to determine male versus female. Well, as you can tell, Mittens is lacking any genitalia. However, she's closer to a female. You would be looking for vulva and in females, obviously a penis, previews, and testicles in males. Whether or not the animal is intact, you will see evidence of both. However, if you do have a spayed female, you're likely, possibly, to see incisions on their abdomen. Trimming nails. Again, I do not have the permission of a cat owner currently to be trimming nails. Since it's different for cats and dogs, I'll show you on Mittens' paw here. If your cat is sitting nicely for you and allowing you to do the restraint, you would take their paw, pushing at the top and from the bottom. When you do this, their nails will actually go out because they're able to retract and extend their nails, you would push out, exposing their claws, and then you would trim one by one. And also never forget to check for a dew claw and cut it if necessary. Same with the back paw, or the back paws. It would be the same. When I trim cats, I like to have my arm under their head so that they can't bite me unless they're the rare case of cat that lets you hold them there. From the bottom and the top, push forward, extend the claws, and clip again. Always have a quick stop nearby, and always thank and pet your patient afterwards. Bye!